Hi guys, welcome back to my channel. First of all, I want to apologise for not being on for almost 2 months. I've been dealing with some problems and trying to get my head around a few things, and I've started my cognitive behaviour therapy for my health-generated anxiety disorder. So apologies, I've not been on. I just wanted to come on and basically give you another update. I feel like all my videos are just update, but I promised you that I would come on my last video. I think it was about waiting for my MRI results, and I promised that I would come on and give you them results when I got them. Roughly a couple of days after I did that video, I sent a message to my medical professionals with regards to having to wait nearly 2 months for results for scans, and that it was unacceptable, and that patients put their lives in their hands, and I felt like they were messing with mine. And I explained this because, for those that don't know, I have a mediastinal growth. Mediastinal just means chest cavity growth, and it's basically plush against my T4, T5 spine. So for those that are new to my channel, that's what that means. And I found this mass out, found out that I had this mass in in October of last year. I'd gone for a scan in the September because I'd had a lot of frequent urinary tract infections, and spina bifida runs in my biological family. And I figured, and obviously tethered spine is also associated with spina bifida. So I asked my doctors to check for any spinal problems to rule out the cause of having these frequent UTIs. And they decided to give me a full neck to lumbar tail spine scan MRI. I went to see the GP in the October, roughly around the end of October, roughly around the 20th plus onwards. And I asked him, had he heard anything back from this MRI? Because it was only routine. I wasn't expecting results really quickly. But it had been like almost 2 months, because I went at the beginning of September for the scan, and it was towards the end of October that I was waiting. And I still hadn't heard anything. And he said to me, has no one contacted you? And I said, no. And he said, oh. And I went, why? And he said, well, we found something. He said, you haven't got tethered spine. He said, but you have this mediastinal growth. And obviously they want you to have another one as urgent as possible, because we have to rule out things like cancers and stuff like that. And me being me was just really humorous about it, and basically was just laughing and joking and saying that I was going to look like I'd be glowing by the end of it because of the scans. And he brought me straight back down to earth and was like, oh no, an MRI is just like, it doesn't contain radioactive stuff, it's just magnets. And I was like, yeah, I know. I was just trying to lighten the situation, because I know how hard it is for doctors to technically almost give bad news over to patients. So I was trying to make things a little bit easier for me to hear it and for him to give it. But anyway, I got this result back roughly around the end of October. They then sent me for another scan, an urgent one, which I got by the 12th of November. And they told me the result of that on the 23rd of December last year by text message. So you can imagine how annoyed and angry I was at the fact that I had waited from the 12th of November through to the 23rd of December for results, despite the fact about 2 weeks prior to that, I had actually contacted the hospital and made sure that they sent that message over to the doctors, because I asked them, was the result there? And they said, yes, it's been there. And I said, well, can you please send it over to the doctors, because I'm waiting to hear from it. I said, because it was an urgent scan. And she said it'd be sent over that day. And I still had to wait an extra possibly 2.5 weeks, only to get the result via text message, stating that my growth didn't seem to appear sinister, but they would have to keep an eye on it, again after 6 months. So naturally my curiosity got the best of me, and I had to phone the doctors up and say, I've just received this text message. What does this mean? Can I have a copy of my results? And they sent me a copy of my results, or rather I went down and got them, and it basically showed that my mass had grown over a short period of time, and they needed to keep an eye on it again with a follow-up scan 6 months later. It turned out my scan was supposed to have been done from 6 months from my last scan, which was the 12th of November, but they actually did it from 6 months from my result date. So I didn't get my scan done until the 24th of June, and it should have been done in the May. Even my family doctor was like, you should have had it by now, and I was like, nope, gotta wait till the end of June apparently. So I had this scan done, and then in July I phoned just after this scan was done, I phoned the hospital and I said, how long am I going to have to wait for this, because it was sent as urgent, and obviously I had to wait up to nearly 8 weeks last time, and it's driving me mad because it's setting my anxiety levels through the roof. And they said, oh, because of COVID, we've got all our backlog down, so you won't wait more than 2 weeks. And I was like, oh, that's great, fine, great, that's awesome, thanks. I did the video, which was my last video that I did on here, and they still hadn't given me my results back. And about a few days later, they still hadn't given me my results back. And we're looking at roughly now the 2.5 week mark. So I sent them a message explaining that I was annoyed at the fact that I'd have to wait up to nearly 2 months for urgent results, and that it was setting my mental health off and anxiety wise, and I was just losing control of my life, and that how patients put their lives in their hands, and I felt like they were messing with mine. And I got a call back from the basically the manager of my medical group, from my family doctors, and they said to me that they understood it completely. I apologised for if I sounded abrupt to them, and they said not at all. They understood where I was coming from. It was unacceptable to wait nearly 2 months for a urgent result to come back in. He personally had phoned the hospital that before he phoned me, and demanded that result was sent over, and they said that they'd already had that result and it had been sat on for a week prior, and he said, well, that's unacceptable, we need to have it because we have to process it and put it on the system, and this patient is having to wait longer. So he assured me that I would have the result back either that afternoon or by the Monday at the latest. And I was like, thank you, Lord, thank you. And I thanked him so much for getting back in contact with me. And I again apologised for having to write to him and explain that I felt like I was being neglected and basically just being pushed to one side, and that, you know, for something so serious like a growth in your back, in your chest cavity, to be held off to give results, it's going to cause concern, because obviously to that point we still didn't know what it was. Anyway, that's Saturday. We sometimes have in our doctor's office, we sometimes have a clinic on a Saturday morning, and it only lasts till 1 o'clock. And I decided that I was sick of being in the house, and I was on a shielding list, but I really needed to get out because my head was just exploding. So my brother and I went to B&Q to look for a shed and to basically just do stuff. I put a mask on, did everything right for COVID. I was in my wheelchair and I hadn't been out in it. It was the first time I'd gone out in it properly. And for those that have been in a B&Q shop, you know how big they are. So I was thankful to have my wheelchair. So anyway, we went to B&Q. We then went to a different shop, and I was in B&M Garden Centre at the time. And I got a phone call on my phone, and it was about 2:30, 3 o'clock in the afternoon, and it was from the doctors, and it was my family doctor that I love to pieces. I think he's great. We have a good laugh. He was the guy that gave me the results the very first time that I asked for them, which was in the October, and he'd been following me up ever since. And he basically apologised, explained that he understood where I was coming from. I said, I really apologise that I had to chase these up. I said, but you can understand what it's been doing to my mental health. And he totally understood, and he totally got where I was coming from. And we had this really long conversation, and he gave me what appears to be the result of this particular scan. They still not 100% sure of what it is. I still have to have another scan in about 6 months' time, which is around about Christmas, so it'll probably be more like January. The referral for that has already been sent. However, the good part about it is it has not grown at all anymore since November of last year, which is a good point. The bad point, obviously, is they still don't know 100% what it is. They're still guessing what it is. So they're still guessing it's more than likely a neuroenteric cyst. They're not going to do anything about it unless it's causing symptoms, which it is, but they're still not listening to me. And I've got to have this another scan to make sure that nothing else has changed in the next 6 to 7 months. So that's pretty much my result for my MRI scan. And yeah, I'm still none the wiser. I did speak to my GP because obviously in past videos I have mentioned with regards to the fact that I have got symptoms of classical EDS. And I was told when I got diagnosed that there was a potential for me to have classical EDS, but because I was diagnosed by the rheumatologist, the only way to formally be diagnosed with classical EDS is to have genetic testing. And because obviously I have 2 children who also show signs of EDS and one that is currently showing signs of POTS and also has very transparent skin. And because I don't know really much about my family history with being adopted, I only know parts. So the parts I know they have on the system. I asked him about referring me to genetics. I explained why I wanted to go. It also shows apparent that myself, my brother, and one of my daughters, possibly both of my daughters, show signs of having supraventricular tachycardia, which is another condition that I have. Which I will mention in more detail on another video when I'm talking about doctors in general, which I'll do shortly. It's becoming apparent that we all have symptoms of this. Now, I have full-blown SVT. My brother has been told he has a milder form of this, or he possibly may have a milder form of this. And my daughter, my eldest daughter, has been told that she has a rhythm that is associated with SVT, but it's just something that needs to be kept an eye on. She's not been formally diagnosed with anything. I'm really hoping that she does not develop this because it's a really debilitating condition. And for those that don't know what supraventricular tachycardia is, or SVT as I call it, it's basically a condition which is an electrical abnormality in your heart, which can trigger your heart to beat anywhere from 180 plus up to roughly around 300 plus beats per minute at any given time. And obviously for somebody that has dysautonomia issues like brain fog, syncope and UTIs and all these other things going on, I've spoken to my family doctor, the one that I really like to talk to, that gave me my results recently. And I asked him about postural orthostatic tachycardia syndrome and asked him whether there is a potential that I have it, because the last time he saw me, I'd actually blacked out and I had a massive big bruise on my head. I actually have a bit of a bruise on my head at the minute because a fence panel fell on my head. I asked him with regards to whether or not there's a possibility that I could have it due to the fact that I get tachycardic an awful lot. If I stand up, I will get dizzy really quickly. If I look up, I get dizzy. If I bend over, I get dizzy and I fall over. And if I get too hot, I feel really nauseous and feel like I'm going to pass out pretty often. And he said it was very, very likely that I did have POTS as well. So at the moment, I definitely have SVT. I'm awaiting to see my cardiologist with regards to, because I did have a telephone consult over the phone with a different doctor that I don't normally see, who's referred me back to the doctor that I do see, saying that it's imperative that I see him, because he agreed with my family doctor that there's a chance that I could have POTS, and it's very highly likely that I do have POTS, and also because of the fact that on a recent ECG they'd found that I had a long QT interval. It wasn't marginally too far out, but they want to keep an eye on it anyway. So there's a potential for me to have 3 different conditions wrong with my heart. And because of that, I really need to be kept an eye on. So this has been reiterated to my GP. For those that are watching this that are not from England and you're from a different country and we're saying GP, when we say GP, we mean family doctor. I've probably said this already. Because most people know the initials GP, meaning gastroparesis, but we call our family doctor a general practitioner, so we call them a GP. So if you ever hear me referring to my doctor as a GP, it just means general practitioner, and it also means family doctor. So this is why I keep saying family doctor, so that people understand. But basically, my GP, family doctor, is aware of this, and they know that I need to be kept an eye on. I'm still waiting a Holter, and I did express that 24 hours is not going to be enough, and therefore I'm still waiting to be given a Holter monitor for a while. Thankfully, and I don't know if I mentioned this in my last video because I don't watch my own videos back unless I'm obviously going to be showing them online, but in order to edit, but my echocardiogram that I had also came back as being fine. There's nothing going on with my valves, which is really good. So yeah, I'm just a waiting game. So at the minute, because of weakness down my right side and tremors, I am waiting to see neurology, which is really, really good. I think because they've been focusing so much on the mediastinal mass in my chest, they've neglected the fact that I actually have degeneration of my C5 and C6 spine, which obviously branches off the nerves down the rest of your body. And I think because of that, it's causing the problems with my arms and my leg, especially on my right side. It also causes significant headaches and stuff. Now, they will refer to my MRI that I very first had, where they were checking signals and everything. But for those that have had MRIs and CTs before, you will know that your head is in blocks. So basically, it's pretty much like they stabilize you and they block your head in so that you can't move from side to side with your head. So your back and your head is completely in alignment and completely straight. And for those that don't know, I had arthrocentesis done on my left side of my jaw, and they propped my head so it was like in this type of position. I'm going to go really dizzy now. And because of that, I ended up with severe pain from here upwards, and they had to give me probably like 2 or 3 shots of morphine on top of the morphine I'd already taken that morning of my own, in order to kind of bring down that pain level. They had to give me a heated blanket. They had to give me a lot of stuff in order to get rid of that pain. And that's because if my head is in any other position other than completely straight, like I'm getting pain here at the minute because I'm slightly to the left. If my head is in any other position other than straight, for any period of time, the signal level gets blocked, and then I end up having to, I end up with a really bad headache or pain up my head, or I'll end up with pain down my back or anything like that. And that's because the signals are getting trapped. But obviously, once I put my head in a more straight position again, like I am now, then it basically, the signals go back to normal again, and it helps ease off any pain and troubles. And this is something that they're neglecting to look at, because obviously when you're having a CT or an MRI, your head is in perfect alignment with your spine. So the signals have got nowhere else to go other than up and down and be perfectly normal. So I've written all this down in order to tell my neurologist when I go and see them, and also to explain about the problems that I'm having with my mass, or roughly where I think my mass is, because it's still causing severe breathlessness and it's still causing pain regardless. So hopefully they'll do something about it, and I'd rather they do something about it now while I'm still able to deal with the surgery, because I know it's really, really stupid to probably say, but I don't deal very well with general anaesthetic, as most people with LS don't. I've never done well with it at all. And given the fact that I have heart issues, which will probably just gradually get worse as I get older, I would rather have treatment now, like, because in order to sort this mass out, they would have to remove it, especially to find out exactly what it is. For definite, they would literally have to remove it, and that's quite major surgery, and I would rather have that surgery now while I'm still fit enough to have it, than wait for a year, 2, 3, that might cause me more problems or start growing again, for me to then be in a worse health rate condition than I am already, and not be able to tolerate the surgery as much. So I hope that makes sense. I'm sure it probably does to those that understand. But anyway, I'm going to go, and I hope you all have a nice day. If you enjoyed this video, please give it a thumbs up and subscribe. And I apologise it's so long, and again I apologise for not coming on sooner, which is probably why it's so long. But yeah, another update. Enjoy your day, and I will speak to you again soon. Bye.